Hello and welcome everyone. My name is Dr. Manickam and I'm a pediatrician. And here's a deep dive look at how you should feed your baby during the first 1 to 2 months of life. So in a prior video, we've said that you should feed your baby every 2 to 3 hours, roughly 2 to 3 ounces of breast milk or formula. But one other way to look at that is that your baby should feed at least 8 times during a 24-hour period. That includes at night. Your baby isn't able to maintain their sugar levels in their blood quite as well as an older baby or as an adult, as an older child. So it's important that they feed at least every 4 hours. So that 2 to 3 hour period is the goal. But the most important thing for you to keep in mind is that your baby can feed as often as they'd like and as much as they'd like. A good example of this is after about 2 weeks of life, a lot of babies have something called cluster feeding. Well, they'll feed every 30 minutes, and that is okay. They can eat as much as they want, as often as they'd like. In terms of breastfeeding versus formula feeding, oftentimes we'll recommend breastfeeding if you can. Breast milk has been shown to help babies in so many different ways in terms of improving their immune system function as they get older, decreasing other types of infections, and so forth. But of course, it takes a lot of time. So if you're able to, great. Otherwise, having them fed is the most important thing. Formula is also wonderful. When you do breastfeed or bottle feed, talking to a lactation consultant is the best thing. They know the best tips. But general advice, especially for bottle feeding, is that when you feed your baby, try to keep them vertical as you bottle feed. That way gravity can help them swallow. If they do spit up a little bit after they feed, that is totally normal. We only really get concerned if they are vomiting pretty excessively, so a large volume, pretty forcefully out, or if there's any blood in whatever they spit up or vomit. Those are the reasons to go to your pediatrician. Additionally, one other common question parents have is when their baby can first eat solid foods or puree foods for the first time. It's typically between ages 4 to 6 months, but it's dependent on 4 different criteria. One is if your baby is able to reach out and grab food. 2 is if they can bring their hands together midline. 3 is if they have good head control. You might notice when they're younger that they kind of lean their head back. They should have good head control before they are able to eat anything. And then 4th, they should show interest in the foods that you're eating at the table. If they do hit all those 4 criteria, typically above age 4 months, that's when we can talk about the first foods that they can eat, typically puree foods. And we can go through the criteria in another video in terms of things to think about when you do get to that stage. If you have any other questions or concerns about feeding, please let us know. We're happy to give any more information. Here are a few more caveats and clarifications for you to keep in mind as you listen to our videos. First, all the information that I share is my own clinical opinion and not reflective of any of the other institutions I was a part of before or are currently. Second is that all the information we share is for full-term babies who are born greater than 37 weeks and have no other medical abnormalities or medical issues. So make sure you talk to your pediatrician before implementing any of the tips that we talk about to make sure that they're tailored for your child. And lastly, for any medical professionals in the audience, if you have any other clarifications or advice you want us to include in our videos, please send us a direct message, email us. We're happy to include them as well. And if you like what we're doing, please click the like and subscribe button below. That way you can stay tuned with all the information that we share for parents. Thanks for listening. Take care.